Hi Stasia, how are you doing today? Good. I'm Madison, I'm going to be your student nurse. I'm going to do a head-to-toe assessment on you. It should take about 15 minutes. Is that okay? Perfect. I'm going to start by taking your vital signs. Okay, so I got a heart rate of 80 and a respiratory of 16. Are you having any pain today?
Oh, my head hurts a little bit.
Okay, and when did you first start noticing that your head was hurting?
Like yesterday morning.
Okay, on a scale of 0 to 10, 0 being no pain, 10 being the worst pain you've ever had, what would you rate it?
Probably 4.
Okay, and is there anything that makes it better or worse?
Tylenol.
Okay, so once we're done with this, I'll check your chart and see when last time you had Tylenol and if you can get any more, okay? Okay, and then, can you tell me your name?
Stasia.
Do you know where you are today?
At Bryan.
And do you know what the date is?
It's April 22nd, 2020.
Okay, thank you. Okay, and then I'm gonna check your pupils. I'm gonna have you look right at my nose. And I'm just checking to see if your pupils are equal, round, and reactive to light, which they are, and you're alert and oriented times 3, and your conversation is appropriate for how we're acting, and you're responding with appropriate mood, so that's a good sign. And then I'm gonna check your mouth next. So I need you to just open it, and I'm just gonna shine the light in. And I don't see any open sores. It's pink and moist, which are all good signs. And then I'm gonna check your skin turgor, so I'm just gonna pinch a little bit of skin here, and it recoils immediately, so that's a good sign. And then I'm gonna go ahead and check your arms now, so I'm gonna check the integrity of them, especially on your elbows, and if there aren't any open lesions. Your skin color is even with the rest of your body. And then I'm gonna check the temperature, and it's warm all the way down to your fingers. I'm gonna check for the color of your fingernails, and they're pink. Capillary refill is within 2 seconds, which is a good sign. And then, are you having any numbness or tenderness or tingling in your hands or your arms? No? Okay, good. Now I'm gonna check your, and if you had an IV site, I would take a look at that, but you don't. But I would make sure there weren't any kinks in it, there wasn't any redness or coolness at the site. So now I'm gonna go ahead and take your respirations. I'm gonna place my stethoscope on a couple of different areas. Every time I put my stethoscope on a spot, just take a deep breath for me, okay? Good. Now I'm gonna go ahead and, are you having any shortness of breath or trouble breathing? No? Okay. Now I'm gonna check your heart. Okay, I'm just gonna go under this time. Okay, and your apical and radial are equal in rhythm, which is a good sign. Then then I'm gonna go ahead and check your bowels. Are you having any issues with constipation or diarrhea?
Mm-mm.
Any changes in your bowel habits? No? Okay. Okay, so you have active bowel sounds in all 4 quadrants. Now I'm just going to do some palpations. I'll do light and a deep, and just tell me if you're having any pain or tenderness with those. Any pain with that?
Mm-mm.
Any pain with that?
Mm-mm.
No? Okay. Are you having any troubles with your bladder? Are you having any burning sensations when you urinate?
Mm-mm.
Does your bladder feel fuller than normal? No? Okay. It's not distended and you're not having any issues, so that's a good sign. So we're going to move to your legs. So looking at the integrity, you don't have any open lesions. There's no signs of ulcers on your heels. The color is even with the rest of your body. The temperature is warm bilaterally all the way down to your toes. Your toenails are pink. Capillary refill is within 2 seconds. Then I'm gonna have you push and pull. Are you having any numbness or tingling when you do that?
Mm-mm.
And I just realized on her upper extremities, I would have had her grasp my hands as hard as she could. Forgot about that. So you push and pull, you don't have any issues there. So everything looks good with those. And on her urinary system, if she had a catheter, I would check to make sure it was positioned correctly, there weren't any kinks in the tubing, and everything was flowing correctly, but she doesn't have one of those, so I forgot. And then on your musculoskeletal, her extremities are even in length and tone, and they move with the similar motions. And if I was testing her gait, I would have her walk normally, but she doesn't use any assistive devices, and that's not necessary for the purpose of this assessment. And if you had any tubes, drains, suctions, or incisions, I would check to make sure there was no redness at the incision sites and that everything was flowing in and out accordingly and everything was set to the correct rates. So I am done with my assessment. Thank you for your time, and that concludes.